We will now continue to look at how the Greensboro Health Disparities Collaborative seeks racial equity. In response to these observations, Greensboro residents decided to organize.
The Greensboro Health Disparities Collaborative was brought together by a group called the Partnership Project in Greensboro.
And go through an Undoing Racism training. And we brought in Ron Chisholm, the founder of People's Institute, and the wife of his co-founder, Diana Dunn. And they did 2 days of this Undoing Racism training. And they did it at 2 different times because everybody couldn't come at the same time. So we offered it twice.
They were so profound. The trainings were so profound that people wanted to know more, and they wanted to have a better understanding of what we were doing in the partnership project.
The elder that brought us together was pushing it, making sure that we went through this training so we can see and understand what racism really is and what it is. Not just I don't like you, we don't like each other, but the systemic issues and what racism really is, the things that permeate across our country, the implicit bias, the things that are not necessarily seen.
Racism isn't about individual acts of bigotry or prejudice or behavior. It's about structures that produce disparate outcomes. And so the community members at that time approached some researchers who had expertise in community-based participatory research and said, we would like you to work with us because we want to tackle this thing at the root. And at that root is power.
The people who made the decision to form the collaborative, the Partnership Project, they started by talking to people in the healthcare system in Greensboro who were familiar with health research and were connected to the University of North Carolina at Chapel Hill. And they went to Chapel Hill through their connection with the health system and interviewed researchers at UNC Chapel Hill and connected with people from the School of Public Health who were interested not only in health disparities, but also had foundational as a part of their work community-based participatory research.
What I would bring is the community-based participatory research approach. And we felt that this would be an innovative, because it's never been done, because the Undoing Racism training had not been applied yet into health disparities and with the healthcare system. They looked at many other systems, but not with healthcare. And with community-based participatory research, I had been addressing for about 20 years at that time health disparities, working always with communities of color, especially in rural areas, so in the States as well as internationally. But my focus at that time, up until then, had really been on individual or interpersonal behavior change. Patient-provider interaction, building trust, cultural competency training, really at the interpersonal level. And what opened my eyes from working with the Partnership Project and being exposed to the Undoing Racism framework is that it's a system. It's really systemic. And that the individuals, the white individuals as well as the people of color, patients, providers, are all products of this system and aren't even aware of how they are contributing to this structuring of opportunities and disadvantages and advantages. And so for us, we decided we needed a collaborative of about 35 people. And of the 35, the majority needed to be from the community, and then a proportion from the medical care system and proportion from the academics.
Well, at the time, we didn't have any community-specific data. we just had an inkling of people's stories of whether they had difficulty getting their diabetes treated or hypertension treated, or a lot of folks had stories about breast cancer. And so even though we didn't have actual data, we felt that there was enough of a signal that we could approach the health system and start thinking about ways of formally getting data and moving forward. I mean, one thing that was really important at the time is that electronic health records, when we first started, were not prevalent, and so it was not easy to get real-time data, and so it kind of left our only source as the cancer registry. And as we found in doing the CCARES study, the cancer registry wasn't so hot at the time either. The cancer registry, we knew, was a data repository that cancer centers were required to contribute to, so we anticipated that the data would be fairly complete. Again, we really didn't have the option of electronic health records, and so that would have meant doing hand chart reviews, and we really didn't have the money or the person power to be able to do that. And so the combination of the fact that Cone Health was willing to be cooperative and be transparent with the cancer registry.
The greatest challenge is working with the institutions that we're trying to help change and them wanting to change. It's one thing to know that you have a problem, but it's another thing to actually want to engage in that problem, to actually change. So a medical institution that may spend millions or billions of dollars a year to do it one way, and you say that's wrong and you got to change it. It may cost you more money to change it. It may be for the betterment, but you're so used to doing it one way. And a lot of times we get comfortable doing it how we've always done it, and this is how we know it to be done, so we want to stay this way. But now we're actually exposing a sickness or a disease or institutional problem that you got to correct. And sometimes the institution don't want to admit it, coming from outside of the institution telling you them about themselves.
Because people will inherently go on the defensive. Change is something difficult for everybody, and when you look at the information that's put on a screen and you're part of the healthcare provided to an individual, and you look at it and you say, why are those outcomes different? Because I think that we're treating everybody the same way. That leads to, I'm sure we'll get into it, the implicit bias of how come those outcomes are what they are. That doesn't make any sense. So the data that we started collecting, that's the first standpoint. If you measure something, you can take action on it. If you don't have the measures of something, you don't know whether you're making an improvement or not making an improvement. Just be prepared that when you get that data, you're willing to be open to it and not say, well, we can explain it away and we know what's happening, versus let's really think about what's happening and then take the next steps to make an improvement and impact people's lives.
As you just heard, the Greensboro Health Disparities Collaborative managed research studies that have been funded by the National Institutes of Health. Their research projects have been unique because they aim to eliminate racial inequities through system change interventions in medical settings. The collaborative stayed true to their approach of addressing structural and institutional racism in the healthcare system by organizing their approach around the anti-racism principles of transparency and accountability. They focused on eliminating racial differences in the completion of treatment for early-stage breast and lung cancer patients. Some of these system change interventions included enhancing the medical staff by adding a specially trained navigator, designing and implementing a new informatics tool that synthesized data from the electronic medical records system on patients by racial category, and providing whole staff professional development on the root causes of racial disparities in institutions. After more than 12 years of invested time, some paid, some voluntary, the Greensboro Health Disparities Collaborative is still together and meeting on a monthly basis. They have achieved successes in their research studies by eliminating racial gaps in cancer outcomes with lung cancer patients. They are continuing to write more grants that will help them to seek their noble mission to establish structures and processes that respond to, empower, and facilitate communities in defining and resolving issues related to disparities in health.
think there have been many successes. I think with CCARES, our first research study on breast cancer from 2005 to 2009 was successful, and it actually spearheaded the development of or creation of Sisters Network Greensboro.
Well, the first success is that we're still here. And then we're building more collaborations, and we're actually touching others that are not in our city, that's actually touching people across the country and literally across the world, with some of the articles that we've written and some of the publications that we've had that show this work, that show the collaborations that are possible when you have true, real community involvement. So we're showing that is possible to be done for other organizations to have real relationships where it's not one above the other, but we're working together.
The biggest one are the outcomes that we've had for our patients, the increased outcomes, the improved care that we're providing to our patients.
The fact that we've gotten 2 major medical systems to start looking at their patient outcomes by race is huge. It's huge. And that we're seeing that the intervention we've designed is having the outcomes we intended. Like, that's amazing. It's not just, oh, there's a little bit of change, it's kind of sort of significant. No, really, people's lives are better. That's big.
One important thing to say is that we're just starting.